teaching of skills within this video in no way implies that the viewer will be able to perform the skills. The skills viewed may only be performed when authorized by a certifying or licensing agency. Any devices used in this video are for demonstration purposes only. Other brands may be used as per local preference.
This video will demonstrate how to establish intraosseous vascular access. This technique may be performed on both adult and pediatric patients using a variety of commercially available devices. Establishing vascular access is often difficult or impossible during life-threatening emergencies in infants and young children. Using an intraosseous or IO needle to give drugs or fluids is an excellent alternative to cannulating peripheral veins in critically ill or injured children. The IO space is highly vascular and functions as a temporary, non-collapsible access. In children younger than 6 years, the sites most readily available and preferred for use are the proximal flat broad tibial plateau, 1 to 2 finger breadths below the tibial tubercle on the anteromedial surface, and the distal femur, 2 to 3 centimeters above the external condyles in the midline. In older children, the medial distal tibia, 1 to 2 finger breadths proximal to the medial malleolus and sufficiently posterior to avoid the saphenous vein, may be used. Be sure to avoid the epiphyseal plates of the distal femur or the proximal and distal tibia. Contraindications include recent fracture to the extremity, infection, burns, or cellulitis. To begin, assemble the equipment. This includes an intraosseous infusion needle, either a manual or a powered needle and insertion drill, a syringe filled with 10 milliliters of sterile saline, antiseptic, intravenous fluid and tubing, and tape. Ensure proper body substance isolation by donning the proper level of personal protective equipment, and then make sure that the patient is in a supine position. Prepare site with alcohol or betadine. Place a towel roll under the knee. For traditional IO insertion, pierce the bony cortex of the proximal medial tibia just below and medial to the tibial tuberosity on the flat side of the bone with a firm back and forth twisting motion to enter the marrow space. Do not push hard on the needle. A pop may be felt as the needle passes through the bony cortex and into the marrow cavity. Remove the stylet and aspirate marrow contents. Keep any bone marrow aspirate for glucose check or for other tests in the emergency department. Note that sometimes marrow cannot be aspirated. Confirm correct placement by infusing 5 to 10 milliliters of normal saline without resistance and feeling the calf to assure it is not becoming swollen. The needle should be stable in position. Attach an IV line to the hub or to an extension connector and stopcock, and infuse fluids or drugs directly into IO space. Secure the needle to the overlying skin with tape. For a Cook needle, apply gauze to the site, then tape the needle in place. For Jamshidi, the plastic overlying the body of the needle should be twisted until it is resting against the skin, then taped in place. Monitor the surrounding soft tissue to ensure that there is no swelling to indicate leakage of fluid. Continuously infuse fluids to maintain patency of IO line. An alternate to the traditional manual IO is the Easy IO. This device is approved for IO access in the proximal humerus, distal femur, proximal tibia, and distal tibia in children. Select the appropriate needle for the patient's age. Although the 15 mm in-length needle is red, and for children 3 to 39 kilograms, it is often too short. So, use the 25 mm in-length needle, which is blue and can be used for children 3 kilograms and above as well. The Easy IO kit shown here is a training kit. The actual 25 mm needle used in the field is solid blue. There is also a larger adult needle for those greater than or equal to 40 kilograms with excessive tissue at the insertion site, which is 45 millimeters in length and yellow. Attach the needle to the Easy IO drill. Position the needle and Easy IO drill at 90 degrees to the bone. Insert the needle into the skin, then press the trigger on the drill handle and apply moderate pressure, while letting the drill do the work for you. When you feel the pop, you are in. As with traditional IO insertion, refrain from placing your other hand behind the insertion site to prevent possible palm penetration from excessive force. Disconnect the Easy IO drill while leaving the needle in place. It should simply pull off as it is a magnet. Withdraw the needle stylet and confirm placement by aspirating of blood with the syringe. However, the inability to aspirate blood does not necessarily indicate improper placement. Confirm correct placement by infusing 5 to 10 milliliters of normal saline without resistance. Remember, if a small child needs fluids or medication in an emergent situation, utilizing an IO needle could save valuable minutes that may have otherwise been spent searching for a traditional IV route. To provide rapid IV fluids, a pressure bag should be used, or use a push-pull system with a 3-way stopcock.